LFT or liver function tests, also referred to as hepatic panel, are a group of blood tests that measures the level of several substances that are enzymes and proteins excreted by your liver. Levels that are higher or lower than the normal can indicate liver problems. Several biochemical parameters are assessed in LFT. These are number 1, bilirubin, that is of two types, conjugated and unconjugated, alanine aminotransferase, abbreviated as ALT, aspartate aminotransferase, abbreviated as AST, alkaline phosphatase, abbreviated as ALP, gamma glutamyl transpeptidase as GGTP. Let's now see each of them one by one. Bilirubin. Bilirubin is a breakdown product of hemoglobin. When RBCs complete their lifespan, which is of 120 days, they are destroyed in the body and hemoglobin is released. The hemoglobin further breaks down into heme and globin component. The heme component is then converted into biliverdin, which further converted into bilirubin. This bilirubin is of unconjugated form, also referred to as indirect form, which is insoluble in water, so it binds with the albumin and then transported to the liver. In the liver, bilirubin is converted into conjugated form, which is water soluble and can be excreted easily through the urine or feces. So, if there is an increase in the level of bilirubin, it indicates something is wrong in your body. The main causes of bilirubin level in blood are number 1, hemolysis, that is the breakdown of RBCs, number 2, failure of conjugating system in liver, and number 3, obstruction in biliary system. Our next biochemical parameter or test is AST, aspartate aminotransferase. AST was previously called as SGOT, serum glutamate oxaloacetate transaminase. AST is high in heart muscles, liver, skeletal muscles, but low in kidney, pancreas, and RBCs. Damaged tissue releases AST in blood, therefore, AST level in blood is directly related to the extent of cellular damage or injury. AST level in plasma is elevated for 8 hours after cellular injury and peak levels at 24 to 36 hours and returns to normal in 3 to 7 days. AST levels in blood is always higher in patients with number 1, chronic hepatocellular diseases, acute hepatitis, number 3, cirrhosis, and number 4, acute extrahepatic obstruction. Factors which interfere with the serum AST level includes number 1, pregnancy, in which there is a decrease in the AST levels. Number 2 is exercise, which increases the levels of AST. And number 3, drugs such as antihypertensives and oral contraceptives also interfere with the levels of AST. The third test we will talk about is alanine aminotransferase ALT. ALT was previously called as SGPT, which stands for serum glutamate pyruvate transaminase. ALT is mainly found in liver. Lesser quantities are in heart, kidney, and skeletal muscles. Liver injury causes elevation of ALT levels in blood. ALT is more liver sensitive or specific indicator of liver diseases as compared to AST. Its level is directly related to the extent of cellular injury, and raised level of ALT can be seen in chronic alcoholism, hepatic cancer, and chronic cirrhosis. Alanine phosphatase ALP. ALP is primarily found in liver, bones, and placenta. The test has low specificity for liver disorders because there are other conditions that can also increase the level of ALP. These are cholecystitis, in which there is an obstruction of intra or extrahepatic bile duct, pregnancy, bone diseases, specifically osteoblastic cancers and Paget's diseases, and newborn growth can also cause elevation in ALP levels. So because of these uncertainties, another test is performed called as GGTP. GGTP, gamma glutamyl transpeptidase. This test is highly accurate in indicating cholecystitis. It is the most sensitive liver enzyme for detecting biliary obstruction, cholangitis, or cholecystitis. GGTP level is very high in liver but low in kidney, heart, intestine, brain, and prostate gland. Elevation of GGTP levels parallels that of ALP in liver diseases, but GGTP is not increased in bone disease. So, if ALP is increased but GGTP levels are normal, that indicate bone diseases. We hope you have found this video very helpful. If you liked the video, hit the like and subscribe button. Follow us on our social sites to get notified about latest videos.